Government is increasingly being criticized for not amplifying its call for everyone to get vaccinated as soon as possible. Experts believe we're just not vaccinating fast enough, and government's communication around the coronavirus has been tainted by the digital vibes scandal. So what now? COVID Comms is a volunteer group of communications professionals like Chris Vick who are pushing accurate information about the virus. So what does he think government should be doing differently to get more people to join the vaccination queue? Chris, thanks a lot for joining us. What would your advice be to government right now?
Well, Tafuma, it's the same advice we've been giving government for more than a year, since the lockdown was initiated and since coronavirus started taking a toll on our people. And that's to communicate as often as possible, as clearly as possible, and in as many languages as possible. And unfortunately, government in particular lost a lot of ground in the early days of the coronavirus. It's starting to catch up, but I mean, you are correct to refer to digital vibes. It seems that the 150 million rand that was stolen from government now means not only that people are enjoying the proceeds of crime, but that the people of South Africa are suffering because government doesn't have the budget to produce the communication materials necessary to deal with this pandemic.
Even if they had the budget, Chris, how do you fight the misinformation that's swirling around? And for a lot of people, those who believe in conspiracy theories, you get sort of tunneled into videos and articles about those conspiracy theories. And even though there is lots of other information flying around, it just doesn't get to them.
Yeah, it's a menace, I must say. It's a real threat to public health. In the work that COVID Comms is doing, we've been able to distinguish between people who are keen to get vaccinated, and they are doing it. They're going out there and getting their jabs. There are people who are hesitant, and we believe they can be persuaded, and they are being persuaded to get vaccinated. And then there are people who are vaccine resistant, and unfortunately they tend to be fundamental and fundamentalist about everything they believe in. They're the hardest nut to crack. They're very, very difficult to have logical conversations with. We're focusing our energy on people who are vaccine resistant because we believe they can and will change their minds. So what we're doing and what we're seeing government and others starting to do is to explain the science behind the vaccine, how it works, what difference it can make to your own personal health, and what it can do for your family and community. And gradually, I think we're chipping away at the hesitancy. The resistors, I honestly don't know. I think that maybe they need to know more, they need to learn more, but they don't seem to want to do that. The key challenge is that kind of middle group that wants to do it, is a little bit uncertain, and can possibly persuade it through some effective communication. I mean, our work really is to explain that the vaccine saves lives, and we show the statistics in terms of your recovery rate being much, much higher if you've had the vaccination. It prevents serious infection and it prevents death. And those are the messages that we're trying to get out through our communication platforms now.
So with the health department facing the kind of funding difficulties they're facing right now, you think public-private partnerships with people like yourselves could be the answer to get proper messaging? Well,
they are proving to be the answer. COVID Comms is one of a number of the civil society groups who have weekly meetings with the government communication and information system, the Department of Health. But we're joined by business, through Business for South Africa, through labor, the trade unions are represented there. And there are a number of civil society organizations doing the same work. So there's a collective spirit that's starting to develop. One of the major challenges is budget, right? The fact that all this money's been stolen from government means no money to communicate there. So we're stepping in, others are stepping in, and there is a united effort that's starting to develop. We're playing catch up, we're working on tight budgets, but thanks to WhatsApp groups, social media platforms, etc., it's fairly inexpensive to move the material once it's developed. So in COVID Comms, for example, on our website, which is covidcomms.org.za, there's lots and lots of free material that people can download. And we're encouraging them to do that. Little infographics, animated videos, sound files, which you can download for free and you can post on your family WhatsApp group, your neighborhood WhatsApp group, your work WhatsApp group. to spread information that way. We're getting by. We're doing what we can with the limited funds available. Our volunteers are working incredibly hard. The key thing is to get the message out there. And I mean, channels like eNCA can be very helpful in that, in terms of providing basic education material in plain language that your viewers can understand. We really need a national effort right now.
Chris, what about incentives? We've seen lots of retailers offering incentives across the world in different countries. There's been lots of colorful things that have been offered as incentives for vaccinations. What's your take on that? Should we see more of it, less of it?
It's early days. I mean, Wimpy has been offering people a free cup of coffee after they've been vaccinated, which I think is quite a sincere offer. Game is offering discounts to people who have vaccination certificates, which will hopefully increase the take-up. The flip side, though, is it then becomes a rallying point for the people who are opposed to vaccination, who talk about boycotting Game and doing things like that. So it's a mixed bag. I think that employers in particular should be doing whatever they can to get their own staff vaccinated. I know the banks are putting a lot of effort through BankMed, their medical aid scheme, to get employees vaccinated. But I think the biggest tragedy is it's the people who are suffering from poor nutrition, from poverty, from inequality already, who not only have the least access to information about vaccines, but are probably having to make the hardest, most difficult trips to get vaccinated. So one of the options that's being looked at is mobile sites that can go to communities and provide vaccinations to people. That's why I say it's a national effort. It's going to take everything: the corporate sector, employers, organizations that have constituencies outside the urban areas. We've all got to work together now. We've got to get the fourth wave under control before the end of this year. Otherwise, it's going to be a long haul back.
Chris, last question for me. Do you think enough is being done to communicate in all of our official languages?
I don't think so, no. I mean, at COVID Comms, we have the option of translating into 6 languages. Sometimes we can do work in 11. But there's 2 challenges. One is finding a pool of translators who can do this work, which is incredibly difficult. The other is explaining these very complex scientific and medical concepts in plain language. So we put a lot of effort into both of those, getting plain language out of the medicine and science, and then getting it translated into as many languages as possible. As I say, it's not easy, but it is a priority, because we need to engage with communities and people in the languages they are familiar with. We need to engage in language that is not medical and scientific. And that is another area where there has to be a significant push in the next few months if we're to make a breakthrough and get to figures of 15 or 20 million South Africans who are vaccinated.
Chris, thanks a lot for your time. Really appreciate it. I think making sure we communicate in all the languages that are official in South Africa would go a long way in pushing those vaccination numbers up. Communications expert Chris Vick, who's also the chairperson of the volunteer group COVID Comms.